I'm Carole Taylor. On this edition of Journal, the complexities and needs of our aging population. Now, I'm a baby boomer, and to this day I'm astounded that institutions never saw us coming. With at least 5 years warning before this population boom hit the school system, it seemed to be a surprise when we all arrived. Not enough desks, not enough classes, not enough schools. But that bureaucratic miss is nothing compared to what we face today as these same baby boomers age. Who knew? Who knew boomers would need more and more complex health care as they got older? Who knew that it would become harder and harder for some seniors to pay rising rents on a fixed income, leading to an increase in homelessness for those over 55? Who knew that along with longer lifespans, there would be a commensurate demand for those not able to take care of themselves, a demand for long-term care beds and assisted living services? Well, here we are, and now we know. According to BC's Seniors Advocate, we need at least 5,000 new long-term care beds, as the wait list for seniors needing these beds has grown by 200% in just the last 10 years. And the shortage becomes a choke point for our entire healthcare system. Hospital beds are often occupied by someone ready to be released from acute care, but can't until a long-term care bed is available. Then the ER gets backed up because a patient that should be admitted to a hospital bed has to stay in the hall of the emergency department because there isn't an open bed upstairs. Sounding the alarm on this issue, as well as ageism, is Dan Levitt, our seniors advocate. He joins us after this break. Dan Levitt is our seniors advocate. And I have to say, Dan, I really appreciate the reports that you're putting out from your office. And people should go to your website and have a look. They can see different topics that all can really concern seniors and some of the issues out there with lots of details. But if I said to you just broadly, looking 5-10 years out, what worries you the most about seniors?
Well, what concerns me most about going forward and around the aging demographic is our denial of aging and perhaps an ageist perspective. And I think if we embrace aging, then we'll make the kind of investments that are needed to make our province, our country, and globally the right place for older people to age. When we think about the baby boomers, that 20-year period of time where at post-World War II, and we think about the oldest baby boomer today, she's 79 years of age. You fast forward to 2036, in just under 11 years from now, she'll be 90. And we have about a decade now to get this right, to make the investment in infrastructure and to embrace aging as a positive thing. That may be the greatest achievement of humankind, is that we're living longer. So we've got to make sure that that longevity piece is equal to everyone, and that we're making the kinds of investments in infrastructure and in supports needed for that aging demographic.
And you've said that looking forward, we need at least 5,000 more long-term care beds. And it made me think that the last provincial election, it seems to me I heard the Premier announcing, I think it was 5,400 beds. How's that going?
So we issued a report in the summer, and we talked about the fact that going forward, to just keep up with the current gap that we have in terms of the number of beds compared to people waiting for the number of beds, we're going to need, according to the Minister of Health, we're going to need almost 17,000 beds, a 50% more increase in the number of beds than we have today. And people today are waiting 10 months on average for long-term care. A decade ago, they were waiting 5 months on average. And when we think about the number of people waiting, there's 200% more people today waiting. 7,200 people are waiting for long-term care. These are people who should be getting 3.36 hours of direct care, sometimes from a nurse, sometimes from a carer. These are professional staff, and the burden has really been shifted onto the family members. And if we don't invest more, we're going to see things like hospital emergency rooms being plugged up because too many seniors are going there where they would have gotten that care at home or in a long-term care home. Or they'll be in that hospital waiting for placement or the ambulances will be taking them because they don't have a driver's license. And it's putting pressure on adults, often in the workforce, who are caring for their loved one. And so it's not good for the caregivers because they're now stressed out, their well-being isn't being enhanced, and certainly the person at home waiting for long-term care isn't getting the care they should be getting.
So that promise was made during the last provincial election. How many have been built?
Well, when we track the number that have been built, some of them have been announced, some of them are going to be opening, some of them haven't started yet, but we're falling behind in terms of the number of people who need long-term care versus the number of beds we have. So we have approximately 29,000 beds in the province. If all those beds get built in the next 5 years, there'll be approximately 32,500 beds. And then we need to, and there's no plan beyond the next 5 years. So we've got to make sure that the next decade we're building enough beds to support that aging demographic who are going to need long-term care. We can do things like reduce the co-payment for home support, which would help people age in place at home. We can have other kinds of supportive housing for seniors, more assisted living. These are all subsidized programs. We need to do all those things plus build those additional long-term care beds.
And so I'm just not seeing enough beds getting built. I'm hearing lots of announcements and cutting ribbons and all that. But there was one kind of appalling example in Cranbrook that a reporter was following, and it was for a new long-term care facility. And of course, over time, delays and budget goes up. And it worked out to $1.5 million per bed. You can't tell me we can't build beds in a better way.
Oh, absolutely. The cost of building has gone up. We all know that. But the kind of beds that we're building, the kinds of structures we're building, the ones that have been announced in the past couple of years, many of them are being built adjacent to the hospital. Not necessarily in the city center where seniors want to live. Not necessarily in the neighborhoods where their family and friends live. And the actual places, perhaps you could argue they're overbuilt. Some people would say that, where the design pieces, they're building more like an institution, more like a hospital style. Whereas if we can build them more like your own home, and where people would actually want to live, you don't want to live in an institution the rest of your life, so we can build them like your own house. It'll probably cost less to build too. And in fact, we're seeing a movement around going from the large institutions, which are being built unfortunately. We're seeing, and some of them are needed, but we're really seeing a movement around this small household where maybe a dozen people live together in a house. They could be stackable in urban areas or spread out as like bungalows or single stories, ranchers in more rural areas. But we've got to see that kind of investment, and we can build them a lot cheaper than we're seeing. And there is an awareness that they're too expensive to build right now to that level. So we are trying to move the price down to a more reasonable amount, but to make sure that they're the right kind of places for seniors to age when they need long-term care.
So how do you deal with this? You do the research, you talk to people, you have ideas about how it can be done better, and you do a report. How do you get things changed?
So we do a lot of work kind of behind the scenes, meeting with Ministry of Health officials. Now we have a Ministry of Infrastructure who will be building these structures. So we're meeting with those people as well as the ministers responsible and deputy ministers, and also talking to the public generally about this, so we can see a seniors plan, specifically around long-term care investment. We're challenged in our province right now with an economy and a big deficit that we're looking at, and that the debt is certainly a challenge for seeing infrastructure investment. But I don't think there's a way around this. I think we have to make sure that we invest in long-term care for subsidized long-term care, publicly subsidized. At the same time, we're seeing the private market building a lot of private paid long-term care. For example, one company on the west side of Vancouver is building approximately 1,000 units. So where government doesn't step up, the private sector will. That will work for people who can afford it, but it won't work for many seniors who can't afford that and who are relying on subsidized long-term care.
And so is the answer there to get government to help subsidize some of those private spaces, or do you just say, oh, it's only for people who can afford it?
Well, it's an interesting idea, Carole. If and this happens in other jurisdictions, for example, in Australia, where if you are eligible for long-term care, you essentially have a voucher and you can go to the marketplace and you can decide where you go. So you might choose a particular home for location, or maybe because of your religious background or your ethnic background, or you might choose a government-funded, operated home, or you might choose one that's for-profit, and you come in with a certain amount of money that the government pays for, and you pay the difference. So there's different models out there, but certainly the idea of a privately owned and operated private pay care home where someone could move in and choose to move in there would be something we should be considering and thinking about.
You know, another side effect, sadly, is homelessness. And there was a spokesperson from United Gospel Mission who was saying, you know, this was a characteristic of homelessness that we hadn't seen before. More and more seniors are in this category. Now, some of them have lived on the street for some years and they've just aged. But there are new people coming into the homelessness community because of whether they couldn't afford rents in their house or they couldn't get into long-term care. And, you know, he said, the things you don't think about is you've got to think about placement of beds. Well, for seniors, maybe they've got to be closer to the washrooms, or maybe you have to think about mobility issues. So it's changing the whole complexion of the homelessness services. I'd like to talk to you a little bit more about that, and also your latest study on ageism. Right now, we'll just take a short break, and then we'll be back. I just introduced the idea of the homelessness situation, now including more and more seniors who just don't have a place to sleep or live. What's your take on what's happening there?
Well, in the most recent homelessness report for the Greater Vancouver area from 2025, 22% of all people who are homeless are over the age of 65. So approximately 5,000 people are identified as being homeless in that report. And we think about that, over 1,000 of them are going to be seniors. And those numbers have gone up in the past 10 years. They've doubled approximately in the past 10 years. So more and more people who are homeless are seniors. And people who are homeless for the first time, 45% of them are over the age of 55. So when we think about this, there's more seniors. Service providers will tell me when I go around the province meeting with people who are helping and supporting the homeless population, especially seniors, we're hearing more and more of the people in food bank lineups have gray hair. More people, more seniors who are using meal programs are also seniors. So we have to think about how do we build shelters, for example, and how do we support a homeless population when, for example, they're not designed for seniors. You think about if they're bunk beds, we need to make sure that a senior who may have some accessibility challenges, maybe mobility issues, and might be living with some chronic conditions, where's the bathroom in relation to where the bed is? We've got to make sure the bed's easy for them to get in and out of, and to make sure that the shelters are placed in areas where seniors feel safe, as well as things like having supports so they can age well there and find a better place to live more long-term, so that especially seniors who are at precarious housing challenges, people who are homeless, we've got to make sure we have supports for them so they can have a dignified life as they grow old.
And I would think there's some fragility too in terms of worrying about safety as you get older. You know, who are you in a facility with, and are you safe?
I think that's a big issue is when we think about many of us, as we're younger, we're able to kind of be more aware of our surroundings and perhaps defend ourselves. But you hear these stories from service providers on the downtown east side where a senior is going to cash their check that they might get because they're getting OAS and CPP, for example, and they don't necessarily feel safe going to the bank. And they are being targeted, violent acts towards seniors, elder abuse, etc. So we have to make sure that seniors feel safe in those environments.
I mentioned earlier that you have just done a fairly recent report on ageism, and this is a subtle problem. It's not obvious, like I don't have a bed to sleep. It's like, how am I treated by society? What are the expectations and the opportunities? What were the big findings that you took away? Well,
we surveyed British Columbians and we wanted to find out, we asked them 3 questions. is ageism an issue? Have you experienced it? And if you have, tell us about it. And over 9,000 people responded to the survey, and over 80% of them said that ageism is an issue. And 54% of them said they experienced it, and they told us their stories. It could be as subtle as walking into a clothing store and not seeing someone that you identify with being advertised. So not seeing, if you will, the models having, in those pictures, having gray hair. Or going to that same store to buy clothing, in this case, for a lady's granddaughters, and being ignored by the people working there. And after about 10 minutes of feeling invisible and feeling unvalued, left the store and went to buy some cards, gift cards for her granddaughters, instead of going to that store where her grandchildren really wanted to have the clothing from. It could be that. It could be going to see your doctor for something that perhaps a younger person might get medical treatment for, but the doctor's saying that's just a sign of growing old. Meanwhile, the doctor could easily be offering that senior the choice of different kinds of options, which could include, for example, surgery or other diagnostic procedures that sometimes aren't offered to someone based on the year they were born, not based necessarily on their likelihood of benefiting from that medical treatment. So we're seeing it in healthcare, we're seeing it in general society, and we're also seeing seniors, unfortunately, internalize ageism and deciding not to do things because they think they are no longer able to do that because of their age. So aging isn't the problem. Ageism is. We have to do everything we can to combat it and root it out whenever we see it and not tolerate it.
And it starts even earlier in the workplace. And I'm not a fan of forced retirement because I think that, some people, that's a good time to retire. But for other people, it's not. And yet, I think that there are younger people in that workforce and they think, oh, well, they're just about to move on, push out, and stop listening to the ideas and the experience that's so valuable from that individual. I know I've certainly seen it in the workplace and wonder what we can do to counter that.
Well, first of all, in British Columbia, I think, Carole, when it was your party was in government, there was the elimination of the forced retirement at 65. So in some sectors, people still are forced to retire at 65, but in terms of public service, et cetera, you can't demand someone to retire at that age. What can we do to make workplaces more age-friendly? So ageism certainly, and age discrimination is certainly happening in the workplace. We hear about it from younger workers who actually report more ageism than older workers do. But this idea that older workers can certainly mentor younger workers. And there was a great Hollywood version of this called The Intern.
It was great.
Yeah, a great movie with Robert De Niro and Anne Hathaway. And he basically saves the business by her taking his advice. And those kinds of examples are real. But some of this is embedded, and we can call it institutional ageism, systemic ageism, where in British Columbia, if you are a paramedic, a nurse, or a teacher, a provincial employee, maybe you work for the city, or you could be a federal employee, like maybe delivering the post, you lose certain benefits at 65. And these are people who are in a certain union, perhaps, and they have a collective agreement. And at 65, they might lose their long-term disability, they could lose their group life insurance, and something called accidental death and dismemberment. They're gone at 65. And then at 71, you can't contribute to your pension any longer if you work, nor does your employer contribute. And I know it ties into the whole issue of the RRSPs and RIFs, but it seems like age discrimination to force someone to lose benefits or to no longer continue their pension if they continue working.
And I think we believe in diversity in our workplace, but diversity includes age diversity, and I would love to see more. You mentioned mentoring, but interaction between people who have had lots of experience, people who are just coming along, because both have good ideas, but you've got to be mixing up together.
I agree 100%. When we talked in the past around diversity, equity, inclusion, I always want to make sure it includes older people, includes age, because age is one of the human rights code. So we're talking about DEI, it's got to include age, and making sure that everyone, regardless of the year you were born, is treated fairly and equitably, and that it's good to have people of different ages. And certainly if you're thinking about the marketplace and you think about the baby boomers, that's a pretty strong and dynamic piece of the sector, of the market, that we've got to make sure we're embracing, because our workplaces should be diverse and should include people of all ages.
So what's your next research piece going to be about?
Well, we really are focusing, as we started our conversation, around homelessness and looking at what can be done, what can government do to make a difference. So one of the things certainly we're thinking about is around affordability. And seniors, because they're on fixed incomes, and there is a myth, part of ageism, is that seniors are wealthy. Well, 25% of all seniors are living on less than $2,000 a month. Half of seniors are living on less than $3,000 a month. So they don't have the ability to go out and get more income, nor do they have the ability to necessarily cut some of their expenses. And government has some housing programs. For example, a subsidy for low-income renters called SAFER, which should tie in your income to rent threshold at 30%.
And sadly, some of those programs like SAFER have not kept up with prices and things. I look forward to seeing that next report. Thank you so much for joining us. We'll be back in a moment. A couple of years ago, I read a book called The 100-Year Life. It's not exactly a page-turner, but it presents the thesis that our society is based on an out-of-date model. Go to school, get a job, get promoted, then retire. But retiring in your 50s or 60s may leave you with 30, 40 years of life that you hadn't planned on financially or intellectually. Let me know your thoughts on YouTube. Till next time, I'm Carole Taylor.